Hello, everyone. Welcome to another exciting Wednesday talk show with Vance. I'm your host today. Yes. Today we are here again every Wednesday, 9 p.m. on a very interesting topic. Like I'm sure you'll always be hearing this from me every time I say it's an interesting topic. Today's topic, we are going to talk about iron deficiency. All right. There's so many things that's happening inside our body. Sometimes we are not aware of that. And that actually can causes you a lot of other signs and symptoms and we're just not able to read that. Today, I have a wonderful guest with me today. Who's going to talk a lot about on iron deficiency. So let me get him on board, and he will do the introduction himself. And this is the second time he's coming right on board with Kopi event. So let me invite that special guest. Hello, doctor.
Hello. Hi, Vance. Thanks for having me back.
It's very good to have you again for the second time. I think the one we did was last year, if I'm not mistaken, right?
Might have been about 2 years ago, actually, now.
That's wow, 3 years, yeah. Okay, it just
Yeah.
seems like we just added a talk session last year. Thank you, Doc. I mean, with your busy schedule, jumping in at Kopi events to share what is all about iron deficiency. But before we even start jumping into the topic, we love you to do a short introduction about yourself, who you are, where you're from, so that our viewers would know. Thank you.
Sure. So my name is Dheeraj. I'm a general practitioner, but I have a very special interest in treating nutritional deficiencies, especially iron deficiency. So I work in the clinic that you have up on your screen, the Integrative Medical Centre, by the Iron Suites. We are a general practice, and we believe in holistic health. So we're not just doctors in the clinic, but we have all members of the allied health team. We have a dietitian, we have two naturopaths, we have an osteopath, we have a physiotherapist, and our aim in the clinic is to basically treat the patient holistically and help them from all angles on the left, not just from the medical point of view, but talking to them about their diet, about their sleep, about their movement, and functionality. So
Thank you, Doctor. Thank you so much for that short and nice introduction of yours. Let's talk about this things. I mean, a lot of us will not be aware if someone is in iron deficiency. I mean, for yourself. I mean, for myself, I do donate blood. So every time they give you this, if I'm not mistaken, it's called Florence or something like that.
yeah, that's right. They give you the iron tablets every time you donate blood.
Yeah, so they give you 2 tabs of it, and then of course they give you some, drinks and food coupons. Make sure that
Correct.
you are. But and sometimes of course they check their hemoglobin and kind of stuff. But the real question right now is how one should able to identify whether there's iron deficiency in my body.
Yeah. So iron deficiency is probably the most common nutritional deficiency worldwide. Okay, it's one of the nutrients that we have in our body. It's involved in countless processes in the body, and it's also really important to make hemoglobin, for example. Iron deficiency is a situation where the body doesn't have enough iron, and because iron is involved in so many processes, the symptoms can be far and wide. The most common symptoms that we probably see with related to iron deficiency are fatigue, hair loss is a big one, and also poor concentration. So as you can see, these symptoms are quite vague, and most of the time, the person or the patient just goes on thinking, "Oh, I'm working really hard, I'm not sleeping well. It's normal for me to feel this way," and that often causes a delay in the patient actually coming to find out or coming to know that they actually have iron deficiency. Furthermore, because the symptoms are so vague, sometimes when you go to doctors, they may not test for iron levels. Traditionally, most health screens don't include it. It's not a common blood test that's run in Singapore. And sometimes this may even lead the doctor down a path of giving you a misdiagnosis. For example, or you're just feeling burnt out, or you're just stressed, or in the worst case scenario, you have depression because your mood is low, you can't concentrate, you're feeling tired, and it can lead to a misdiagnosis. It can lead to unnecessary healthcare costs when actually it's just really simply tested by a simple blood test. Sorry, I've lost. I can't hear you.
Can you hear me right now?
Yes, now I
All right.
can.
We definitely going to go and jump into the sign and symptoms in a while of what actually can cause us iron deficiency, what are things to look out for. But doctor,
Mm.
when we talk about iron deficiency, most of the time is iron is important because it helps you to get enough oxygen. Correct me if I'm wrong. Through your
Yep.
body, your body uses iron to make hemoglobin, and hemoglobin is a part of your red blood cells. I mean, so many things are happening in the body without we knowing. Sometimes we
Mhm.
don't even know what is exactly is happening inside. We also see these cartoon characters, Papa eating spinach and kind of stuff. In your clinic, that we talked about, which is called the Integrated Medical Center, but the Iron Switch, how this iron deficiency been tested about?
So it's just a simple blood test. We take 2 tubes of blood, which is a total about 5 or 6 mils, just from one injection point, and we get results the next day. It's a pretty quick, easy test, and basically what we're looking for is something called serum ferritin.
Right,
So ferritin is a key marker of your iron storage levels, and that's the best indicator to check your iron status in the body.
right.
So it's a non-fasting blood test that can be done at any clinic, basically.
If I recall clearly, I came to your clinic, I think about a year, I mean 3 years back, and we did iron deficiency. So I didn't fall into the iron deficiency. I think so, but I got to check the report and maybe have a visit to your clinic very soon. And also, we're going to look at the risk factors.
Mhm.
You mentioned it very clearly. I mean, a lot of us are working like 9 hours, 12 hours a day. We go for quick and fast food, processed food, sort of stuff. And also, we're going to talk a little bit on the nutrition part later part.
Mhm.
But like a burnout, is it also a kind of a risk factors? What are we looking here, doc?
So burnout not really a risk factor that causes iron deficiency, but essentially the thing to understand is that the body can't make iron. Okay, so you have to get your iron from your external sources, and the other thing is that the body can't secrete iron. That means it doesn't come out in your poop or anything like that. But the main way that we lose iron is when we have blood loss. So if you think about your iron level as like a well, let's use coffee as an example,
Yeah.
right? You think about the level of the drink in your cup as the iron levels. You either become iron deficient if you don't put enough in, or if you have a leak in the cup, right?
Right.
So now let's look at the things where situations where you might not be putting enough in. So, for example, we all know that iron usually comes from meat sources, right? So your vegetarians, your vegans, those who are not eating enough meat may
Yeah.
not be adding enough iron into their cup.
Right.
Or let's say you are eating meat sources, you are eating a healthy diet, but you have absorption issues. So think
Right.
about the food that comes into your mouth, it goes into your gut, it has to be absorbed in order
Yeah.
for the body to get the iron. So if you have any chronic gut issues like celiac disease, inflammatory bowel disease, or for example, people who have acid reflux and they're taking anti-acid medication to reduce that acidity in the stomach.
Right.
Now, the bad news is that iron actually needs an acidic environment to be absorbed.
Ah,
So if you're taking antacids to help with your reflux, you might also be impacting your iron absorption.
right.
So those are some of the situations where you're not adding enough into the cup. Now let's think of the situation where you might have a big leak in the cup, right?
Right.
So the biggest one is heavy menses. So that's why it's
Okay.
mostly women who are at biggest risk of becoming iron deficient. So especially those who have a very heavy cycle every month,
Yeah.
when you lose blood, you lose iron. It's
Right.
just the simplest and the biggest risk factor that's associated with iron deficiency. Now, some men may also be iron deficient because they may have blood loss, but that's
Right.
often through the GI tract.
Okay.
Okay? So if you have blood loss through your stool, sometimes you can't see it with the naked eye,
Yeah.
and you may not even know that's happening. So when we see a man who has iron deficiency, that's not common. So that already starts to
Right.
ring alarm bells. And the last
And
thing,
also, doctor, sorry, along the way, just to pause you here for along the way when you mentioned, because women, we know that monthly cycles, some are AB flow, some are, very light. But for men, the sign and symptoms is not much there, right? I mean, unless we go and do a yearly checkup. But, some indications on the poo, when the poo, like, pure, dark, black color, is it
yeah,
also a sign of, could be, right? Is it a sign
yeah.
also?
Okay, so when you have blood in the stools, it may not always look like fresh red blood if you cut yourself.
Yeah.
Sometimes if the bleeding is in the upper GI tract, that means the gastrointestinal tract, by the time the blood gets to the bottom, it actually gets digested, and that looks like what you're talking about, the black,
Yeah.
tarry stool.
Yeah.
It also looks a bit sticky.
Yeah.
Sometimes it can look like a, sorry to say this, but like a raspberry jam, like a
Oh,
dark
okay.
red currant jelly. That could be a sign of bleeding in the gut.
Right.
And as yourself, you said, you donate blood, right? Imagine someone's doing that frequently. Each time you
Yeah.
donate blood, you donate 300-400
Yeah.
mils. That's equivalent of a woman having 4 cycles. So if you do that
Okay.
3 times a year,
Yeah.
it's no different. So blood donation,
Right.
unfortunately, you are
Right.
good. You're saving lives, but you might be putting yourself at risk for developing iron
Yeah.
deficiency as
But doctor, can we also check here? I mean, when we are still talking in the sequence of the blood donation, right? After donating blood, they give you these iron tablets and you
well.
consume it. And also because iron tablets also can consume when you consume iron tablets, your poo also have a higher chances of we talked
Turning
about
up.
it, right? So
Yeah.
it can be a what do you call it, that misjudged. Is there a
Yeah.
chance there as well?
Definitely. I mean, when you take oral iron, we know one of the common side effects is that it turns your stools dark or even black or very
Yeah.
dark green. So it may be mistaken, but I guess the patient should be aware that they've just started taking a new medication and they have
Right.
that, then not to be alarmed. It's likely a secondary side effect to the oral supplements.
Right. And
Yeah.
also, Doc, when we talk about this iron deficiency and the risk factors, because it's quite a very common thing, but we just that some don't even realize it. Is there like a test that you need to do? Like, seems like the HbA1c, every 3 months you want to do. Is there for iron deficiency, for check either male or female? Is there like, once a year you have to do? Is there some kind of recommendations?
I
Or
think I would recommend it definitely for all females to do it
yeah,
about once a year, or if you have some of the risk factors that we talked about.
yeah,
So, if you're a man and you're vegetarian, or you have chronic gut disease,
yeah,
or you donate blood frequently, then when I would recommend it, just adding that serum ferritin to your lab test whenever you do a health screen. And you got to ask for it. Like I said, most of the time it's not included. When you go to polyclinic to do a blood test for your cholesterol or your diabetes, which is your
yeah,
HbA1c, it's not commonly added. In fact,
right,
I would put money on most health screening packages out there, not including your nutrients like your
right.
iron. That's serum ferritin is the key test that we want to do.
Right.
Mm.
And Doc, the same line before we jump into the next question, because it's very interesting here right now.
Mm.
We just now we talked about exhaustion, lethargicness, you get tired. These
Yeah.
are maybe one of the symptoms that your iron deficiency. Is there anything that someone should look up for? It's like, hey, after 40, I'm feel like sleeping more, or afternoon I'm feeling sleepy. The kind of
Yeah.
lethargicness you don't get it in the age of 20, 30, but then in your 40s, you feel like
Mhm.
something slowing down.
Yeah. So let's talk about some of the signs and symptoms, I guess.
Yeah.
So you're right. Iron's most important function is to make hemoglobin, and hemoglobin carries oxygen around the body. So now, if you think of that and you think of if you don't have enough oxygen going to your brain, you might get dizzy, right? If you don't have enough oxygen going to your lungs, you might get breathless when you exercise, for example.
Right.
Not enough oxygen going to your muscles, you might feel fatigue or you might feel extremely tired. So these are some of the common signs and symptoms on top of just the hemoglobin and oxygen carry function of iron. Iron's also important in DNA synthesis. It's also important in immunity. It's also important for hair strength. It's important for nail strength. And if you're having frequent infections where you keep getting a cough and cold every other month,
Right.
or you get frequent tonsillitis or frequent urine infections, that can be a sign that your immune system isn't functioning as well. And iron deficiency can be a cause or can lead to a poor immune response. So it's, there are very vague symptoms, but if you are suffering from some of these symptoms, then do consider getting yourself tested. Um, and coming back to sleep, you mentioned like not sleeping well. So
Yeah.
iron deficiency, in fact, I often have patients telling me they sleep well, they sleep for 8 hours, but they wake up and they don't feel rested.
All
So
right.
it's actually having unrestful sleep that's actually a common sign of iron deficiency.
So these are the few things that our viewers can look out for. I mean, it's like what
Mhm.
Dr. Dheeraj has said. You should check and based on your performances. Even though after your sleep, you should feel fresh after 8 hours. Because if you feel
Exactly.
tired, then it's something that you should uh, ask the
Investigate.
questions to your own self, right?
Right.
And all these tests done in the Integrated Medical Center by the Iron Sweets doc. What is the lab test show?
Yeah. So the first thing that we always run is a full blood count, right? And that's a standard test that you get anywhere, and that shows us the hemoglobin, right? And the hemoglobin tells us whether we're anemic or not, right? So hemoglobin for a woman, I would say the target is 12 and above, and for a man,
Right.
13 and above. Anything less than that, you would be considered to be anemic, and that's when you have too little red blood cells. So that's one of the key tests that we run. And the other one, like I said, is serum ferritin, which
Right.
shows us marker of your iron levels. It's actually your iron storage, and
Right.
studies have shown that that's the best marker of checking your iron levels.
Right.
Now, another important point to make here is that the serum ferritin reference range, in the lab, they always give you the brackets of the normal numbers.
Mhm.
Those vary drastically depending on which lab you go to. And I often find that the lower reference range, the lower point on the reference range is often too low. So, for example, some labs might have a reference range of 15 to 150 being normal. The next lab might show 5 to 200 being normal.
Okay.
Okay. But really, all the studies show that we should be using a level of 30 and above as the bare minimum. So even if you go and do your tests, just look at the level. So let's say your serum ferritin shows a result of 20 and the reference range says 15 to 150. That will flag up as normal
Right.
on the blood test. But I'm saying that the reference range should really be 30 to 300. The bare minimum should be 30. So if your ferritin is anything below 30, and although it looks normal in the lab reference range and the result, I would still say that that is considered to be absolute iron deficiency.
Right. And doctor, I mean, of course, we talk about rate. I mean, those who eat non-veg or vegetarian. It just looks like the vegetarians tend to fall into this iron deficiency more, or it's just like depends.
No, yeah, being vegetarian is a risk factor. So, that is one thing that I would encourage all vegetarians or vegans to check at least once in a year or
Right.
once in 2 years, because iron deficiency is common. The other thing that's also actually very common amongst vegetarians and vegans is B12 deficiency,
Right.
right? It's just simply that B12 usually comes from meat sources. I
Right.
mean, there are vegetarian options like tofu, tempeh that tend to be quite rich
Right.
in terms of B12, but that's another big risk factor for vegetarians and vegans.
Mm.
And the main reason here is actually dietary absorption of iron is very poor. Now, we said that meat sources contain more iron, but bear in
Right.
mind when you eat meat, you only absorb about 20 to maybe 30% of the iron content in the meat,
Right.
right? And for vegetarian vegetable sources, what we call non-heme iron, right? You only absorb 5 to 10% of the iron content in there. So let me give you a rough idea. 1 kilo of spinach, which is multiple bags,
Yeah.
right? Actually only gives you about 1 milligram of iron.
Wow.
Okay?
So I can't
Yeah,
imagine how Papa eats so much of.
exactly.
Okay.
That much spinach, yeah. A piece of steak, for example, which is we all know is high in iron, gives you about 3 to 4, maybe 5 milligrams, right? So there's only so much that we can absorb from our diet. And I just want to tie it back to blood loss, because each mil of blood that we lose, you lose 0.5 milligrams of iron. So
Wow.
half of blood is made up of iron. 1 mil is 0.5 milligrams. So a woman who has heavy menses, when they measured it in studies, they tend to lose about 80 to 100 mils of blood. Now, if you want to think about that in your head, you visualize a Yakult bottle.
Yeah.
So a Yakult bottle is 100 mils. 100 mils per cycle, that's 50 milligrams of iron. So that's equivalent of having 10 steaks, for example, just to match the blood loss from your heavy menses. And
Wow.
when you donate blood, as you know, you probably donate what, 400 mils a time,
Yeah.
right? So that's 150 to 200 milligrams of iron.
Wow.
So blood loss
So I,
is the biggest cause of iron deficiency.
so I got to eat like I don't know how many kgs of spinach.
Take
But
all.
we definitely going to come back into the diet part and also what
Yeah,
the Integrative Medical Center by the Iron Suits can offer into other solutions. If someone is going through a major exhaustion, if they are really in iron deficiency. But let's move on, doctor. I mean, we
yeah,
talked about this, but can you also please talk a little bit more on this
yeah,
about this iron deficiency at the same as anemia?
correct. So being anemic is when your hemoglobin is low. Okay. And I know I talked about earlier, but that's considered a very late sign of iron deficiency. So
Right.
what happens is, over the years, imagine a woman who's got heavy menses, right? Every month they have a cycle, they lose blood, they lose iron. So their ferritin, their serum ferritin, the iron storage level starts to fall. Okay. So a normal level or optimal, what we're trying to aim for is above 100, right? And as they start to fall with each cycle over time, and they start falling below 30, they start becoming iron deplete, meaning there's not enough iron, there's iron deficiency.
Right.
Now, one of iron's role, as we talked about, is the ingredient to make red blood cells, right? So when the iron gets so depleted and the body can't make red blood cells, your hemoglobin starts to fall.
Wow.
And that's when you become anemic. So iron deficiency happens first, and when it's severe and prolonged, it leads to anemia. Now,
Wow.
traditionally, doctors will only look for iron deficiency when your hemoglobin is low. So
Right.
for a woman, 12 is the minimum, 13 in a man. And if you are anemic, then the doctor might go and investigate and look for your iron levels, your B12, your folate levels, and
Hmm.
figure out why
Hmm.
you're anemic. But this process can take 5 years, it can take 10 years. And that poor patient is suffering with the signs and symptoms that we talked about: fatigue,
Right.
hair loss, poor concentration, dizziness. And it only gets picked up traditionally when doctors find a low hemoglobin. So what we're trying to
Right.
say here, if you're having these kind of symptoms, don't wait to that point. Get tested for your iron levels. So think of anemia as a late stage. Think of it as stage 4 cancer.
Yeah.
Why would
Right.
we wait for stage 4 cancer if you can pick it up early?
Right. So I can understand your dog. So we are talking about if someone is feeling some sign and symptoms, and they take, I mean, religious practice on themselves, right? Go and do a checkup, and they find themselves iron deficiency. It can be corrected. I mean, of course, with correct medications or
Mm.
whatever that the integrated medical center you can offer. But if, let's say, if someone falls under anemic, which means that it requires a little bit more, one more step to come iron deficiency, and then to get better. How long will the process will take?
Correct. So let's talk about treatment options. Like I said earlier at the start, right? You can't make iron in the body. So we have to get it from external sources.
Yeah.
The first one, which we sort of talked about, is your dietary absorption. As we know, especially from plant sources, absorption is very poor. From meat sources, it's slightly better. But again, there's only so much that your body can absorb each day.
Right.
Dietary absorption, I would say, is a very slow process. If you're very low, especially if you're anemic, we wouldn't just rely on food alone, because that can take months, if not years. So I think diet will help you maintain your levels once we top you up.
Right.
Now, top up, there's two options. One is oral supplements. Now these come in multiple different brands, like Fluoridex, I think is the one that they give when you donate blood. They
Right.
come
Yeah.
They come as syrups, they come as drops, they come as
Yep.
liquids, multiple different types. But bear in mind, at the end of the day, all these oral supplements go through the same passage as food. So you still face absorption issues,
Right.
right?
Absorption ratio drops depending on the body type and a lot of
It
other
does.
factors.
Yeah, I would say the average absorption for the oral iron that you're taking is about 5 to 10%. So if you look
Wow.
at the dose, the brands that we recommend contain about 100 milligrams of iron, but you're actually only going to absorb 5 to 10%,
Wow. Okay.
right? So that's 5 to 10 milligrams. That's
Mhm.
about as much as you can get on a day. And as you said, they come with side effects. So the
Mm.
most common side effects are the ones that affect the GI tract. So nausea, constipation, black stools, as we touched on. These are
Right.
very, very common. Now, I'm not saying that oral supplements don't work. It is a good first point of call. But if the patient's been taking it, you retest in 3 months, it doesn't improve, or the patient can't tolerate it, we try a different brand and they still experience
Right.
the same thing because of side effects. Then the third option, which is what we specialize in the clinic, is that we give an IV dose, so straight
Right.
into your bloodstream of 500 milligrams of iron,
Okay.
and that's 100% absorbed because it's going straight into your bloodstream, right? It doesn't have to go into your stomach to be absorbed. So it's a big dose of 500 milligrams offers a very quick correction of your iron levels.
Wow.
Sometimes we even go higher, we even go 1,000 milligrams if the
Mm.
person is really iron deficient and they're anemic as well, because we know we need some iron to replace the hemoglobin. We need some iron to go into storage as serum ferritin.
Right.
So based on the results, we talk to the patients and then we talk about the treatment options. Usually it's between supplementation or an IV dose.
Right.
And then we recheck after a few weeks and then we give them dietary tips to help them maintain the levels once they top up.
Doc, you talk about the IV treatment, right? Is it quite common in the world, or especially in this part of area where Singapore is IV is quite very common?
So IV iron in Singapore is unfortunately not very common. Not many clinics offer it. Not many doctors even know about it. It is very, very common in Australia and also in Switzerland, where you just came back from.
Yep.
Over there, it's super common. They give it in GP settings. They give it in half an hour. It's well known. Patients are aware. They get tested, and most doctors offer it in an outpatient setting.
Right. So is that
But in
something they should
Singapore,
not be worried of, right? It's safe. It's sometimes they say, oh, why do I need to put that?
yeah, I guess I can understand patients' fear of having an IV drug
Yeah.
for a medication, but it's essentially a supplement. What the product is, it's an iron core, like the element iron, and it's just like a carbohydrate shell around it, right? What it happens is you inject it into the body breaks down the carbohydrate shell, and it starts to absorb the iron.
Right.
So it offers a quick fix within 3 to 5 days. There are some potential side effects, but nothing major.
Right.
Yes, of course, I won't, lie. There are a few patients, 1%, 2% of patients that have a little bit of side effects, maybe a bit of a rash, a bit of flushing. But the patient is monitored throughout. Then train nurses to check the patient's blood pressure before, during, and after. There's always a doctor on site to treat if anything goes wrong. But 99% of the time, the patient doesn't experience any
Right.
side effects. They walk out in half an hour and they feel fine within a few days. Or in fact, they feel better within a few days.
Is there like a sudden change? You like become like an Iron Man? I mean, of course, not really like Iron Man, but like we talked about is the absorption ratio. Where oral and intramuscular, but eh, the kind of feel, right? You suddenly feel like oh, I'm. Is there some positive changes? What were this like the studies like? For patients or people who go through this.
Yeah. So actually, what we do in our clinic is we call patients after 5 days to ask them how they're feeling, and we actually collected the data. So we actually have data for about 700 or 800 patients over 2 years now, and we saw that 87.5% of them, when asked, do you feel a lot better, better, no change, worse, somewhat worse,
Mhm.
90, nearly 90% said they felt better or a lot better. So, there is a change. Some, I would say it varies from patient to patient. Some
Right.
patients, you report they feel amazing, they feel a lot more energy, they feel a lot more concentration when they're working.
Right.
We have patients who are athletes who are actually, you know, really working out a lot, really training
Mm.
very hard. And they gave some interesting feedback. They said that, okay, maybe the performance hasn't improved, but what they found is that the recovery time between sessions is actually much quicker. So they can
Right.
actually train more frequently. They can actually train harder.
Mm-hmm.
And that was really interesting. That shows that muscle recovery was improved.
Because
And
the
sometimes,
hemoglobin able to supply to the muscles, right? And the whole
yeah,
things
exactly. So
become
there's
very
more
efficient.
oxygen delivery.
Right.
There's more blood flow, which leads to quicker muscle recovery. Right, as a personal trainer, rest is also important. And how quickly you recover can impact
Right.
your
Right.
training. Um, and actually, I would say there are also what I call the intangible results of iron,
Right. Mm-hmm.
because, like I said, it's important for immunity. So you may not feel you may not feel a better immune response, but measure over the next, year or so how often you're falling sick, for example,
Right.
or your nail strength or your hair strength, some things that you just can't measure.
Yeah.
It's also important in DNA synthesis. So there's a lot of positive impact of iron, which you
Yeah.
might not actually feel, but it is important. I will just touch on a little bit here. Actually, there are a lot of studies coming out in the last few years that have measured, in Taiwan, for example, and the UK, when they have a national system where they can look at blood tests from everyone in the whole population. And they've done long studies, 14 years, 15 years, and they saw that iron deficiency was related to increased death rates from cancer and respiratory deaths. So it's
Right.
not just about fatigue or hair. It is actually leads to increased mortality and morbidity.
Right. Wow, it's interesting to know that, how important this is. But again, Doc, I know we have talked about this, but there's some will always want to say, oh, no, I want to take high-end supplement. I say, no, I'm going to get, natural food. I don't believe in, we have different kind of extreme hands, people who want to take this, people don't want to take that. But just by taking iron supplement, I mean, I know we talked about this, but will there be a change, to treat iron
I
deficiency
think
or?
there could be a change, but it's certainly not going to be something that you see in the next 3 to 5 days. It's going to take
Oh,
3 months, maybe 6 months, for your iron
right.
levels to pick up. I think the
Yeah.
important point here is to say, if you think you're iron deficient, don't just start treating yourself, right? Don't just
Mm.
go to the pharmacy or iHerb and order some iron supplements. Go and get yourself tested and
Very
just
true.
confirm the diagnosis. I think that's my most important take-home message. And then once confirmed, yes, iron supplements could help. I'm not saying it's definitely not going to work,
Right.
but in my experience, it often gives a slower change, but it may help, right? So buy a good brand, okay, one that gives you good absorption and least side effects. But then at the end of the day, it's different for everyone. What doesn't give me side effects might give you side effects, right? So I think it's fine to take iron supplements, but get yourself pre-tested, take the supplements, and then check it's working. Recheck in 3 months, recheck in 6 months. Sometimes, doctor says, here's your iron deficient, here, take some iron supplements. You take it for a few months and
Right.
then you never get tested again. And then, it doesn't get dealt with, doesn't get fixed properly. So I think iron supplements has its part, but be mindful, get the right testing done, and then if you are taking it, then check it's working after a few months.
Well said, Dr. Dheeraj. We are now, right now, at Kopi events. We are almost about 33 minutes with Dr. Dheeraj. We are talking about iron deficiency. He is from the Integrated Medical Centre by the High End Suites. If you want to get in touch with him, the contact details are here. A very interesting topic that we are talking about iron deficiency. The human body is like exactly like a car. Sometimes just because you have a driving license doesn't mean that you can able to repair just by putting any wires. Right now, it's all about electronics. So same
Yeah.
thing like our body. That's what Dr. Dheeraj is saying about. Do not try to treat your own self in thinking that these are useful, may not useful. You may be misjudged or mistreated your own self, and sometimes can even go into dangerous, right?
Mhm.
But this is the topic that we're going to talk about, Doc. Very interesting. When it comes to diet, for so much of things, the nutritionist, the dietitian, and some people are just Mr. Google, they would just go up and say, no, I'm not going to take rice. Oh, I'm not taking this. And then another people says that, no, I'm only drinking water. There's so many varieties and various examples that I can talk in my industry over a
Mhm.
period of 15, 20 years that I'm talking about. People just come up with their own diet. Some say, I'm just going to take rasam. Rasam is like the Indian soup. I'm
Yeah.
just going to take that for the next, malnutrition. Some say, no, I don't need carbohydrates at all. I'm going for zero carbohydrates. Some will say supplementary. There's so much of information out there. What
Yeah.
can we learn here, Doc, from the Integrated Medical Center? Because we see it's like a holistic approach. Like you guys are now, giving the service, operating in the world. How can we learn from here?
Yeah, I think you're absolutely right. Everyone looks at Dr. Google and then thinks that's the best diet plan out there. Um, but yeah, you're right. There's hundreds of different diet plans out there. I think I'll put my hands up. Obviously I'm a doctor, but diet is something I talk to patients about. But there are much better people who are more equipped and much more knowledgeable, and that's why at the Integrative Medical Center we work with different experts. We have a dietitian who will spend an entire hour talking to you about what you should eat and what you shouldn't eat. But I think my two key take home messages here would be doing a diet, or like a very strict diet, is often a fad. It's not sustainable, right? You can't be keto for the rest of your life. You can't
Exactly.
just eat rasam for the rest of life. You can't go on a juice cleanse for ever.
Yeah.
I think you got to find something that's sustainable, something that works, something that's healthy in the long term, because no one can be on a diet plan forever. So the key thing is find something that works. So I'm a big fan of low carb, high good proteins, high good fats, and not no carbs, of course, right? Low carbs, because again, no carbs, again, it's not sustainable. You're trying to go keto, you're trying to go into ketosis. You can't do that forever. And then you got to enjoy life too, as well. You got to enjoy life's simple pleasures, right? So a diet should be something that's sustainable. And if you're really trying to change your diet, trying to get a better lifestyle, that comes along with sleep and exercise. So that's what our dietitian, Dr. Naras, does really well. He spends an entire hour and he concentrates on these big,
Right.
huge aspects of your life. So that's the number one tip. And then, of course, I'm going to give some tips about iron absorption specifically. So
Right.
we don't ever force anyone to change their dietary restrictions. So we never force vegetarians or vegans to eat meat if they don't want to. In fact, I can give them dietary tips that can improve the iron absorption. So, my number one tip is, if you're having an iron rich meal, if you're having green leafy vegetables, or if you're having that steak, have some
Mhm.
vitamin C with it, because that improves the absorption in the gut. So, it can be just having some orange juice, it can be having some fruits after. It doesn't have to be an orange. Loads of fruits have vitamin C in them. It
Yeah.
can be something as simple as squeezing some lemon or lime on your salad, and that it's going to improve the absorption that you're
Yeah.
already eating. Now, on the other hand, back to coffee and tea, right? Unfortunately, they bind to the iron you've just eaten, and
Right.
80% of it will just pass out.
Right. So
And that's not
they just squeeze everything out.
exactly. So it sucks the iron, it doesn't get absorbed into the body, and it just passes out. So if you're eating that steak and then you go have that coffee straight after, unfortunately, you're not going to be absorbing that iron. So
Gone.
the tip is to leave it an hour before and after the iron-rich meals. If you want to
Right.
have your morning coffee, I think that's fine, because you're probably not eating steak for breakfast, I hope. So your breakfast is not going to be an iron-rich meal. But the key thing here is also to realize that it's not the caffeine that's in coffee and tea, it's the phytates, it's the tannins. So that's in your herbal tea. I get asked this a lot. Is it in chamomile tea? Is it in green tea? Often it is as well. So please don't think that, oh, I'm drinking a green tea after my meal. That's fine. That's also going to bind to the iron, and 80% is going to pass out.
So now the $1 million question: what is your favorite food, Doc?
I am a sucker for chicken rice.
Not about fish tikka and chicken tikka. All those stuff, all the
um,
grilled stuff.
I'm a very bad Indian. I actually don't really like Indian food, and I can't eat spicy food too much.
Okay. So next lunch date with Kopi with Vance. All right. Deal.
But I love prata though, so you can take me out for prata.
Okay, let's go. I'm also a big believer of food because in the fitness industry, if you look at it, of course, not all coaches does that, but most, or put them in a zero carbs diet. And then what happens that during that period of 1 month or 2 months, they go, I mean, pretty good. They lose a couple of kgs, but carbohydrates is very essential for our body for daily function. Some says no, you have enough in your body, but of course, if you don't have that, you can be hypoglycemia, it's called the low blood sugar, and so many things can happen. But then
Yep.
after a period of 2 months, 3 months, doc, what exactly happened? Because I have witnessed it, they just go crazy. Then they eat
Yeah,
about 5,000 calories a day, 7,000 calories a day, and then you can't control. They lost 5 kg, but then they put on 25 kg. And then
exactly.
you start back the whole regime again. So it's not going to be able to sustain for a period of
Yeah,
time for the rest of the life, right? I mean, you spot on that, Doc.
exactly. So a diet plan's got to be sustainable. Something you can. It's a mindset change. It's a lifestyle change, and you do it once, and it's for forever.
Thank you, Dr. Dheeraj. For all the viewers who are listening right now, this is Kopi with Vance, and together with me is Dr. Dheeraj from the Integrated Medical Centre by the Iron Suites. Interesting topic about iron deficiency, and Dr. Dheeraj is the second time coming on board with a great information for our viewers. So if you want to get more information, or if you feel that you're lethargic, and these are the signs and symptoms that we talked about, the guys are able to contact them, and you can able to check. Doctor, we are also in Spotify and Apple Podcasts, so you can actually listen to them and share to all your friends and families, or even to your patients. We are almost coming to the end of Copy Advance. Doctor, before we end the show, any tips that you have for our viewers?
I'd say do a nutritional health check once in a while because it's not often picked up in health screening programs. So do ask your doctor to get a serum ferritin, a B12, a folate, and a vitamin D. These are the four common nutrients that are easily tested for. Any clinic can do them. You just got to ask for it. Just do it once in a while or whenever you do a health screening, throw these additional nutrients in because it's so important for our general well-being.
Thank you, Dr. Dheeraj. I really enjoyed this session with so much information. And also, I don't want to take more time of you because I know you had a very long day and you just jumped in like a flash, and I know what happened in the backstage. Because this is Dr. Dheeraj spending almost about his valuable almost 41 minutes with Kopi Events. And I enjoyed the session. And also, Dr. Dheeraj take away on all those stuff that we talked about. And you can able to listen to us at Kopi with Vans podcast in Apple Podcasts and Apple and Spotify as well. You can listen to the both, or you can contact them at the details below. Doctor, thank you so much for spending almost about 45 minutes right now. We are definitely going for that. I'm going to bring you for that. I don't know if you have seen my posts, but most of the time I talk about food. And then people
Yeah,
say, hey, Vince, you are a trainer, you are a coach, you shouldn't be eating this. I say, look, don't come and tell me all this stuff because
yeah.
like what you said, it has to be sustainable for the rest of the life. And of course, there's so many things that we can talk about. I'm gonna bring you for fish tikka and a chicken tikka if you're game
I've
for
seen
it.
it. I've seen your dosa and your Indian food post workout. Don't worry, I'm looking forward to it.
And I also burn tons of calories, I eat,
Exactly. You balance
balance
it
it.
out. Exactly.
All right, it's fun and really informative having you at Kopi Events. Thank you so much. I'm very
Thank you
grateful that
very
you
much,
joined
man.
us today, and we will stay connected.
Thank
Thank you,
you. You
doctor.
have a great day.
Thank you. Thank you. All right, viewers, this Dr. Dheeraj. I really enjoy a session with him, especially doctors who love to give educational information through social media to reach out to people at your own home. We can be traveling in the bus or you can be traveling in the plane, wherever you're listening our podcast. I think it's very valuable information on the topic of iron deficiency, how it can affect you. We had a great chat talking about all the details. I mean, of course, not as the whole lecture that we covered about, but the most important iron deficiency that your body doesn't have enough iron to make red blood cells. Iron is important because it helps you to get enough oxygen throughout your body. Your body uses iron to make hemoglobin. Hemoglobin is a part of your red blood cells. And all these, I think, we need to understand, but sometimes we don't really care about what is happening inside, but rather we care what is happening outside, which is, of course, oh, I have gained 5 kg. Oh, I've lost weight. That's perfectly fine to have goals. You got to stick it to it. Don't go on a crash diet. Like what Dr. Dheeraj has said, you need to see a nutritionist, you need to see a proper qualified dietitian to talk about it. And that's what the guys at the Integrated Medical Center by Iron Suites have done it. And I have done the iron deficiency test as well. Unfortunately, I passed it. But of course, as a blood donor regularly for the past 18 years, I think it's very important for me to check as well. I think it's important for you to check. It's because it's your body. You got to take care. I always refer the human body to a car. Just because you have a driving license doesn't mean that you go and, you know, do your own repairs and changes the wire to left and right, negative to positive. You don't want to touch that. Of course, you need to know, and that is why professionals like doctors, scientists, and professors all around there to get get our help. We seek them help, right? So this is Vance. I'm gonna join you again on my next Kopi events, which is coming every Wednesday at 9 p.m. You can also listen to us at Spotify and Apple Podcasts. All right, just type in Kopi with Vance and it will be there. All our podcasts are loaded there, so you can listen to them anytime. And if you do require any assistance, you can contact our doctors as well. So I'm going to sign off and I'm going to catch you again next Wednesday, 9 p.m. Kopi with Vance. Adios, amigos.